Hey guys, welcome back. So let's go into what is medical cannabis. Well, medical cannabis is not a special type of cannabis. It's actually just a natural plant that grows that's known to actually have come from around the Asian subcontinent. And it's a plant which has got two essentially different types, which are known as sativa and indicas. And there also is a third type known as ruderalis, which can actually be included into the subtype of the sativa. It's been known for many generations for actually being used to produce different things like hemp fiber, hemp seeds, hemp oils, leaves, vegetable juices. It's also been used for medicinal purposes, also recreational use. And there's so many different types of breeds because of the genetics have been mixed, meaning that you can flower different types of plants containing different types of levels of THC and CBD. These are the two most known cannabinoids within the plant. The research has found there's somewhere between 80 to 100 different cannabinoids within the plant, and about 300 non-cannabinoid chemicals within the plant also. And this is why the plant itself has so many different types of uses and benefits in a medical purpose, because there's so many different compounds within it that act on different receptors within the body. Now, going into those might bore you, and my channel doesn't go into that kind of detail because there's already topics and videos and research that is there for you to watch, and there's no point me replicating it. But what I can go into is in the medical and practical application of it, because that's what I'm involved with. So how are these plants used for different signs and symptoms and diseases and conditions that patients actually experience? So the different types of plants can be used in different ways, in such as oils that go under the tongue, gummies that can be ingested, so edibles, and then also through the actual flower bud itself that can be inhaled through a vaporizer. These different methodologies exist to be utilized in different ways. For example, if you have an edible, it's going to be absorbed slowly, and it's going to have a longer release time, lasting several hours. Whereas the flower bud, when that is used, it's a quicker onset and it works much more rapidly, but it also wears off much quicker. So the best way to think of this is, for example, for pain. It would be like having a long-acting painkiller versus a short-acting painkiller. Also the difference between rapid onset and rapid relief. And so therefore the speed of onset of how it would work can be used to treat different conditions. For example, if there's a certain type of a headache that's not controlled by conventional means, and then you're wanting to use medical cannabis and you're eligible, then a certain type, for example, through a vaporizer can be used because of its rapid speed of onset. So therefore it can help your symptoms. You wouldn't want to be using something that has a slow onset that works over a longer period of time, just because it's not going to attack the symptoms and treat that straight away. Whereas if someone is having, for example, like chronic pain and symptoms that are there all the time, throughout the day and throughout the night, then you'd want something that is much longer lasting, like the oils, like the gummies, that are working constantly in the background, lasting several hours. It's like the long-acting painkiller effect. So we know the cannabinoid plants and the cannabinoid receptors work in different parts of the pain pathway, but it doesn't work for all types of pain, and that's where we've got to be a little bit careful and sensible. Medical cannabis is not going to be suitable for all types of people with certain different symptoms, and what may work for someone and where they get good benefit from it, other patients may not. And that's why it is regulated by the doctors, and that's why you're seen by doctors and followed up with the doctors, because it's important, because if it's not working, or you get ill effects, known as side effects or adverse effects, which are genuinely actually known to be much lower than compared to traditional medicines, but still safety exists, and that's why then it is regulated through specialist doctors. And that is the way that it should be, because safety for patients is always number one. The cannabinoids from the plant also work on the inflammatory system within the body as well, to produce different effects, to also control symptoms from those conditions that cause inflammation, such as those of the inflammatory bowel like Crohn's, ulcerative colitis, as well as those of the arthritis like rheumatoid arthritis. So they work well for those, but again, it's the same concept that it may work for a significant amount of patients, but it may not work for all. That's why it's something to bear in mind that yes, there's lots of results and research, and the patients that we see have massive benefit, but not all of them. So it's important to bear in mind that it's not just a one size fits for all, and that not everybody may benefit from it. And that's just the natural case within medicine, that not everybody benefits from a certain type of a treatment. And that is due to the complexity of different medical conditions, how different people interpret pain, how their pain is being stimulated, and how it works on different receptors, and also individual patients' receptor genetics. And therefore, that's why it's much more complex than simply just giving a medicine and having an outcome. But a lot of the research out there is showing the massive benefit that patients are having due to medical cannabis compared to taking traditional treatments such as within the opioid family, like codeine, tramadol, oromorph, zomorph, so of the types of morphine, fentanyl. These types of things, they do work well in their own right, and they're very good for short-term use, but they also do have their side effects, their complications, things to do with dependence and tolerance and addiction, which is to do with the receptors. And therefore, actually, those types of adverse events and reactions that people get from it, the side effects, they don't want to be on those medicines too long. And actually, medical cannabis doesn't have that type of a profile for those side effects and reactions from those types of medicines. So actually, there's a lot more benefit that comes from this part. And as the research grows, those thoughts and processes might change. So more research is definitely needed to be done to prove the validity, to prove what we call sensitivities, specificities, to essentially show further, more concrete proof and evidence that it is working and is working for the right reasons. And it's through evidence that we get the confidence of patients, of everybody else, to show how well it does work. Thanks for listening. I'm going to try and keep my videos short, sweet, and informative. Let's grow this channel together. Remember, like, share, and subscribe. I'm Dr. Mivi, your specialist doctor here. See you all in the next video.